Okay, let's proceed for our lesson for today. Disease and epidemiology, prevalence and incidence. So, epidemiology is okay. Is the study of disease distribution. Hold on. Is the study of disease distribution, timing, and transmission of to recognize and control outbreaks. So it includes etiology, the study of disease causes, and then the investigation of disease transmission mechanism. Analyzing disease in a population. Epidemiology analyzes diseases within a defined population. Susceptible individuals may be identified by behaviors or environment. Morbidity refers to the state of disease, while the morbidity rate expresses the proportion of disease individuals in a population. Prevalence and incidence. Prevalence meaning the total cases in a population at a given time. Incidence, when we say incidence, it's a number of new cases within a specified period. Example, in 2012, HIV prevalence was 467 per 100,000 with an incidence of 13.7 per 100,000. So prevalence and incidence, in this graph, you will see the HIV prevalence and incidence in the USA from 1980 to 2010. And obviously, it keeps on rising. So the red line is the active HIV or AIDS infections. It's getting higher and higher. And then these are actually the new HIV infection. I think I've shared to you before the reason why these infections, this line keeps on going up and it's not diminishing or not going down, because once you got HIV, it will be there forever until you die. So at the moment, we still don't have any cure for HIV. But you can see that the cases of HIV, it's going lower, and it reached a certain plateau because of the advancement of our technology. We already have people are already more aware of the HIV, so they um, have sexual intercourse safely. And then we also have what we call the PrEP. This is a medicine that can protect you from HIV. Okay, let's go to the disease and epidemiology patterns of incidence. Okay, so is sporadic diseases occur occasionally, like rabies and tetanus. Endemic disease, when you say constantly present in a region. So, like example, the malaria in Brazil. Epidemic disease, larger than expected cases in a short period, like seasonal influenza. So, a pandemic is an epidemic occurring worldwide. So, example, HIV and AIDS, that's pandemic. And of course, the COVID-19. Okay. So, you will see in this graph percentage of emergency visits for flu-like symptoms. So, the blue one is 2006 to 2007. The red 2008 2009, and the green is 2007 to 2008. This one is percentage of all deaths due to influenza and pneumonia. Mhm. Let's go now to disease and epidemiology, pioneers of epidemiology. Okay, when you say etiology, it is identifying the etiologic agent of disease requires controlled experiments. Many signs and symptoms are non-specific, complicating direct causation. Cox 4 criteria establish a causative link between a microorganism and disease. So you can see in this picture the Cox postulate. So pioneers of epidemiology. John Snow mapped the 1854 cholera outbreak, linking the disease to a contaminated water pump. We have Florence Nightingale kept detailed records during the Crimean War, leading to medical reforms. We also have Joseph Lister develop antiseptic procedures using carbolic acid, reducing surgical infections. Let's go now to disease and epidemiology, disease reservoirs. Disease reservoirs and carriers. Pathogens persist in reservoir, living or non-living. Some survive in soil or water, like Clostridium tetani, while others persist on surfaces. So we have the carriers. We have the passive carriers, contaminated but not infected. Example, and wash hands of healthcare workers. Active carriers, infected individuals transmitting disease. And then the last one is the asymptomatic carriers carry disease without symptoms. Reservoirs and carriers, zootic diseases. Animals serve as reservoirs and can transmit diseases. One is the defective host, the host where a parasite reaches sexual maturity, and intermediate host, an immature life stage. Next, disease and epidemiology, modes of disease transmission. So modes of transmission occur from reservoir to individuals, then is spread through direct or indirect contact. Pathogens employ diverse transmission mechanism. So we have the contact transmission. Do we have that? Okay, contact transmission. Direct contact transmission, person to person, like touching, kissing, and droplet sprays. Vertical transmission, mother to child, pregnancy, birth, breastfeeding. Horizontal transmission, mucous membrane contact, like sexual transmission. Let's go now to vehicle transmission. We have the waterborne transmission, like contaminated water. We also have the airborne transmission, use the dust or aerosols carrying pathogen. Next, the vector transmission. Mechanical vector, pathogen carried on an animal's body without infection. Examples are the flies. Biological vector, pathogen replicates inside a host before transmission. Example, mosquitoes or lice. Like this, the dengue and malaria. Mm. Let's go to quarantine. Quarantine is isolation of individuals prevents disease spread. Used for highly contagious disease like tuberculosis or Ebola. Healthcare associated nosocomial infections. HAIs occur in hospital due to surgical procedures or medical equipment like catheters or ventilators. Global public health, WHO or WHO oversees disease prevention worldwide. Successful campaigns include smallpox eradication, and then HWO and CDC respond to public health emergencies. Let's go to disease and epidemiology, emerging and re-emergent infectious diseases. Emerging and re-emerging infectious diseases, when you say emerging diseases, they are new or increasing in prevalence. Example, Ebola and COVID-19. Re-emerging diseases returning after a decline. Example, drug-resistant TB, tuberculosis, or malaria. You can see in this graph, cases of Ebola virus, this is worldwide, from 1976 to 2015. So these are different diseases with their year discovered, affected regions, and transmission. So AIDS, discovered in 1981, it's affecting worldwide, and the transmission is contact with infected body fluids. Chikungunya fever, discovered in 1952, affected regions in Africa, Asia, India, and spreading to Europe and Americas. This is mosquito-borne. Ebola virus disease, 1976, Central and Western Africa, contact with infected body fluids. Swine flu, 2009, worldwide and droplet transmission. Lyme disease, 1981, Northern Hemisphere, from mammal reservoirs to human by tick vectors. West Nile virus disease, 1937, Africa, Australia, Canada to Venezuela, Europe, Middle East, and Western Asia. This is also mosquito-borne. Okay. All right. In conclusion, understanding disease transmission and implementing effective control measures are critical to public health. Through continued research, vaccination efforts, and sanitation improvements, we can work towards minimizing the impact of infectious diseases globally. With the collaboration of governments, healthcare systems, and organizations like WHO, we can better prepare for and combat outbreaks, ensuring the healthier future for all. That's all, and thank you.